Did you know that contrary to popular belief, if you have an HMO, you are covered anywhere in the United States for an emergency? Hi, I'm Larry Goist, owner of LMS Insurance Group, where we help seniors navigate the Medicare Maze. So in today's short video, I'm telling you guys all about the differences between coverage on HMOs versus PPOs. And I'm going to go over four real basic topics. So number one, I'm going to tell you exactly what HMOs are. Number two, I'm going to tell you about PPOs. Thirdly, I'm going to compare and contrast some of the differences. And then fourth, I'm going to tell you which one's better. And that's all coming up next. Hey, before I dive in, don't forget to like our channel. Definitely subscribe if you find this content helpful. I really appreciate you doing that. Okay, so what's an HMO? Well, for starters, HMO stands for Health Maintenance Organization. And this is a type of Medicare Advantage plan that has a network of doctors and hospitals that you must stay in to get your lowest costs. So when you hear HMO, it is going to be consistent with networks. Now, the one exception to the network is for an emergency. So when you have HMO coverage, when you go to urgent care, you go to ER, or you go to hospitals, it doesn't matter if that facility is in or out of network. Because those things, if you're going in an emergency situation, would be the same copay in network versus out of network. But you do have to be going for an unplanned emergency situation. But outside of an emergencies on an HMO, to have covered health insurance coverage, you have to use the list of doctors and providers that are in network. When people think of HMOs, they typically think of things like having to get a referral. And when I first started doing this in 2016, most Medicare HMOs did require referrals. But as I shoot this in 2025, most HMOs no longer require referrals. So what a referral would be like, you can't just go to a cardiologist. You have to first go to your primary care doctor, who has to refer you to a cardiologist. And this was almost synonymous with all HMOs 10 years ago. But again, in 2025, it is not as common across the board. So if you have an HMO, it's important to check with your plan to see whether or not it requires referrals to go to specialists. Now, HMOs on Medicare are actually going to have lower costs. So you're going to have lower monthly premiums, lower copays, and a lot of the times you actually receive more extra benefits on HMOs. And the reason could be is that the insurer is not paying out-of-network doctors. So because of that, they have a stricter network of doctors that have this agreed upon price and contract. So they are able to offer things at a lower negotiated price because they don't have to worry about paying that out-of-network doctor whatever schedule that they would demand. So as you can see on the screen that just popped up, I did a search in Ohio of just some of HMO plans, and I just scrolled right down the list. And as you can see, the out-of-pocket maximums on HMOs in Ohio are anywhere from $3,000 to $5,000 on average. You're seeing $3,900, $4,100, $4,200. So your out-of-pocket maximum is the most you could be charged in a year. So the lower number, the better. Okay, so what about PPOs? Well, PPO stands for Preferred Provider Organization. Now, the first thing to not be confused about is this plan, it still has a network of doctors and hospitals usually. So when you look at a Medicare plan and it's a PPO, it's going to have one set of prices for in-network doctors, and it's going to have another set of cost sharing for out-of-network doctors. So PPOs do have a network, and if you stay in that network like you did on an HMO, you will receive the absolute lowest prices. But what a PPO allows you to do is go out of network and still have coverage. So remember, on the HMO, unless it was an emergency, you could not elect to go out of network. But on a PPO, they're going to allow you to go out of network, but then usually they're going to charge you more for that given service. So if an insurer was covering 80% of your benefits in network, they might pay 70 or 60% of your claims out of network. So you still have coverage, you have more freedom because you could truly go to any doctor that will accept or bill your PPO, but you might have higher costs if you do choose to go outside of your PPO in-network providers. Now, my experience with PPOs has been that they never require referrals. So on HMOs, some HMOs require referrals. PPOs, you're not going to have to get a referral from your primary care doctor to then go see your specialist. So on a PPO, you certainly get more flexibility and you have access to more doctors, but in turn, you're usually going to have higher premiums, higher co-pays, and less extra benefits. But don't take my word for it. Again, as it's coming up on the screen now, you can see a real life example of PPO coverage in Ohio. And as you're looking at some of these out of pocket maximums, you're anywhere from $7,000 to $14,000. So the HMOs, your out of pocket limits were $3,000, $4,000, $5,000. And the PPO, because again, it's saying you can go out of network, but you are going to then in turn have more risk. As you can see from some of those numbers, you could be billed up to, or you could be responsible for up to almost $14,000 on some of these PPOs. Where if you had an HMO and stayed in network, you'd have only been responsible for maybe $4,000 in cost sharing. So PPOs give you the added flexibility, but are going to also give you a little bit more risk in turn for that flexibility. So let's look at this at a side-by-side. So when you have an HMO, if it's a non-emergency situation and you're going to doctors, you have to use doctors that are in that plan's network, or else they will not pay anything for that service. Now on PPOs, you're going to be able to go in network and receive the lowest cost, or you can go out of network and maybe pay a little bit more, but still have coverage. Now when it comes to emergencies, whether it's an HMO or a PPO, you are covered anywhere across the US. It will be the same copay in network versus if it was out of network. When it comes to copays and out-of-pocket costs, generally, but not always, but generally, HMOs are going to have lower copays and lower maximum out-of-pocket limits. Whereas on PPOs, because of that added flexibility, generally you're going to have higher premiums, higher copays, and higher out-of-pocket limits. So which is actually better, an HMO or a PPO? Well, that depends on the individual. If you are cost conscious and you are wanting to maximize your benefits, if you want to get the most extra benefits, the lowest doctor copays, the lowest hospital copays, well, more times than not, an HMO is going to offer those benefits. But if you want that flexibility, you want to be able to go to any doctor that will accept your PPO. If you want to be able to go in and out of network for second opinions, and you want to be less restricted when it comes to things like referrals, then you might value the coverage that a PPO offers. So very often, if we have snowbirds that spend 6 months a year in Ohio, 6 months a year in Florida, we will recommend PPO coverage simply so that when they are in that second home, they're able to go see doctors for routine services. So good examples of people that are going to want PPOs are people that have kids out of state where they spend a lot of time out of their home state. If you're a snowbird or you do extended traveling and you want to go to regular doctors, okay, those are going to be reasons to take a PPO. But at the end of the day, every individual is going to have their own unique needs. And the important part is that you understand how these two types of coverages work. Because if you have a Medicare Advantage plan, whether it's an HMO or a PPO, you are only locked in for 1 year. And you could always make changes during annual enrollment between October 15th and December 7th. So guys, I hope this video was helpful. I'll talk to you next time. Larry Goist, LMS Insurance Group. Thanks.